it's Dr. Ganaway again. Today, staying on the topic of obstructions in your body and things that are getting in your way. So today I'm going to talk about scar tissue. So we think, oh, okay, well, you injure something, obviously you know that's not great. However, with scar tissue, there can be a number of issues going on. Scar tissue is very dense, and typically things can't get within it without there being some kind of breakdown of that scar tissue, which is sometimes very necessary through manual therapy or injection therapy or different methods. So, I might go over quite a few examples that have to do with women that have been pregnant and that kind of thing. I do have a midwifery obstetrics program I completed, as well as being a naturopath. So I tend to get into that topic often. So even with that, though, the examples will still apply in general to how things work throughout the body. We tend to work on all different areas of the body, but there's some things that are just so common in particular areas that why not use them as examples? So when we're looking at scar tissue, let's say you have a surgical cut in an area. Well, it's very important that your body quickly glom those tissues together. You don't want to bleed out. You don't want things just falling apart or something falling out of you. That's fantastic. However, when that scar tissue is formed, it's generally can be pretty thick unless you've had particular work done in the process. And so what can happen is you can have different nerves stuck in that, different muscles being pulled that might pinch on nerves. You can have altered sensation, so you can have different kinds of pain, different kinds of sensation that don't seem to make sense in the area. There can be numbness, and then there's what structures this is glomming together. So if you have certain muscles that have been cut open and there's scar tissue between the two sides of that muscle, the contractions are not going to be so perfect. With the C-section scars, I often see a little belly hanging over the C-section scar. That's not a lazy woman, it's just what else is there to do. There's something in the way and it tends to build up there, and the muscles tend to get very weaker in that area. Sometimes it goes better than other times for women. I mean, everything depends about where they have to cut. Sometimes it's slightly different, and it was an emergency C-section. Different things can make quite a difference. But in that case, you may have a woman, or in my office, I might have a woman who works out quite a bit and is able to get everything else in shape, but her abdomen is not so much getting into shape. So it looks like she's got a belly, but then below the scar, there might not be any overhang. And so in my office, I'll work on getting that scar tissue more minimal. So the woman can start feeling that area more completely, being able to engage those muscles and have things work well. Another really common example with scar tissue getting in the way is when women tear and burst. This is very common. Sometimes they flat out tear, which is usually a better option just because if the woman's cut, then it's more likely to keep tearing as opposed to the natural tear lines that tend to stop themselves. However, sometimes it's very important that a woman be cut open because the baby's got to come out, just like the C-section can be very important. And so with the case of the tearing or the episiotomy during a birth, the woman she might have some difficulties after. She might have a lot of difficulties right after. She also might start really feeling the effects of what happened to that scar tissue when she hits menopause, and that could be 40 years later. So what goes on there is you've got that vaginal vault, and some of those muscles have been either ripped or cut open. And then at the top of the vaginal vault, from the view of a gynecologist or a primary care doctor that does gyne exams, it would be the top when they're looking straight at it, but more towards the woman's front, is the urethra. for that circle of muscles. And the urethra has these tiny little muscles making it go and not go. And so what happens with the scar tissue is that it tacks down a lot of stuff. And so those muscles that are being affected, which can vary, those muscles do not necessarily have the best strength or cannot contract fully. So other muscles try to compensate, which can sometimes seem quite fine for many years or decades, and sometimes it starts to fall apart when a woman gets older, and then she starts leaking more, which can have interplay with how her hormone levels are and things like that. And just with some women, bioidentical hormone replacement therapy or just other things to help nourish the tissues can be a great option. But the scar tissue does tend to be a problem there. The other thing is, scar tissue. Even if the woman doesn't have a blatant tear, there's a whole woman's head, a whole baby's head going through the canal. And so there's going to be little micro tears. And what happens is they've actually looked at cadavers and seen that the distribution of nerve ganglia in the region of the vaginal vault is distributed differently in women that have had children and who have not. So sometimes they'll feel maybe urinary urgency where they should feel bowel urgency, or bowel urgency where they should feel urinary urgency, or a lot of pain. It can really vary a lot. And so this is all, or a large part of it, can be because of scar tissue, along with blood stasis, which we'll talk about more, because that is another thing that happens quite commonly in the whole pelvis. I mean, not whole pelvis, but in a good portion of it there, that can be quite an issue. And so with that, once again, it's like, well, are you going to use manual therapy to break down the scar tissue? Are you gonna find someone that can do some injection therapy to break down the scar tissue? Because optimally, if somebody's in, sometimes there's reasons why it wouldn't be appropriate to go right for working on those kinds of things, and that's totally fine. And sometimes emotionally it's not, in those particular cases especially, it might not be a good time for somebody. But in general, a good healthy person otherwise, we'd like to get everything working well together, and try to work on breaking down that scar tissue. Because once you have that scar tissue go from a solid block, so something dense that the body will recognize as being a problem, but the inflammation will just surround it without actually helping to resolve it, and will instead often attack areas around it. What you get is that you've broken up this scar tissue either manually in a way it would have just sat there before, or also manually. Injections is also manual, but when there's little bits of scar tissue, then that's something you can get your immune system to come help clear out, your macrophages and all of that, and then that can make a huge difference in function. So we often forget what's built up in our body, and we'll do all these other things to try to work on it, but that is so very important. And then the other thing to realize when you're getting your scar tissue worked on is that sometimes a muscle has been kind of glommed down from scar tissue, and the thing is when it starts functioning, it might not be totally functional right off the bat. There might be some spasming and funny function because it's got to come back on board, but it's important to have all your muscles working for you. But often I'll send people home and be like, hey, maybe you can get some magnesium flakes and soak in a nice warm, not too hot bath, but stay in there for 20-30 minutes. Or maybe they can get some, there's certain magnesium sprays that tend to be better than others, but get a magnesium spray and spray it on the areas if it's deeper muscles that are being affected. Sometimes the soaking in the nice warm bath with the magnesium flakes can be a better option because it can get in deeper. But just a little bit about scar tissue, so I'll leave you with that. Have a great night.